Hello, everyone, and welcome back. Many of us grow up with the idea that a heart attack always unfolds exactly like it does on a movie screen. A character suddenly clutches their chest, struggles to breathe, collapses to the floor, and those around them instantly recognize what is wrong. While those intense situations certainly occur sometimes, that is not the most typical way things play out in reality. In truth, a large number of heart attacks start very quietly, presenting with subtle signs that are easily brushed aside or blamed on minor health issues. This misconception frequently leads to dangerous delays in seeking medical attention because individuals remain waiting for extreme signs that may never occur. Actually, a cardiovascular event is much more likely to begin as an awkward or uncomfortable sensation in the middle of your chest rather than a sharp, intense pain. Those who go through it often describe the feeling as pressure, squeezing, tightness, a sense of fullness, or like a heavy weight is pressing down on their sternum. A few might compare it to having a tight strap pulled around their upper torso. Because this sensation can fade and reappear, many assume that it is nothing major. Others easily mistake it for standard heartburn, indigestion, a pulled muscle, or even just daily stress taking its toll. Regrettably, every single minute lost to these rationalizations allows damage to spread through the heart tissue. Furthermore, the red flags of a cardiac issue frequently go beyond the chest area. Uncomfortable sensations may spread down the left arm, into both arms, up into the shoulders, neck, or jaw, or show up in the back or upper abdomen. You might also experience a sudden shortness of breath, a cold sweat, feelings of nausea, dizziness, or lightheadedness, along with an unusual deep exhaustion that feels disproportionate to your current activity level. These signs can manifest individually or in combination, and they often present quite differently from person to person. Spotting these less obvious signals is especially vital for women and anyone managing diabetes. Women are less likely to report severe chest pain and frequently describe upper back discomfort, jaw aches, nausea, shortness of breath, or deep exhaustion instead. Since these indicators do not align with classic Hollywood imagery, many women wait much longer before going to the emergency room. At the same time, living with diabetes can result in neuropathy, which compromises the nerves that transmit pain signals. This means an individual could experience minimal discomfort or almost zero chest sensation, even as active damage is occurring within the cardiovascular system. The most hazardous decision you can make is to talk yourself out of seeking emergency medical assistance by assuming things aren't bad enough. A lot of people worry about making a fuss over nothing or feeling silly if the evaluation turns up no issues. However, hospital staff would always prefer to investigate a false alarm than to treat a patient who has waited too long and suffered permanent muscle loss. A basic guideline can serve as a life-saving compass here. Should you encounter sustained pressure in your chest or unfamiliar sensations in your upper torso, airway, or overall condition that persist for more than a couple of minutes, treat it as a medical emergency until doctors can confirm otherwise. Taking immediate action might cause some brief inconvenience, but waiting around carries potential consequences for the rest of your life. Promptly recognizing these issues is your initial and most crucial barrier against lasting complications and holds the key to a better recovery process. One essential truth concerning cardiac episodes is that your ultimate outcome is frequently decided well before you set foot in an emergency department. In truth, those first 10 to 15 minutes after the warning signs present themselves can play a massive role in preserving heart tissue. This is because the condition is typically sparked by a clot that rapidly forms and obstructs a coronary artery, which are the specialized blood vessels that feed vital oxygen-rich blood straight to your cardiac cells. As soon as this pipeline is sealed, the portion of your heart depending on that source is starved of critical oxygen supply. Unlike other muscle systems in the body, cardiac tissues can only survive for a very brief window without a continuous flow of fresh oxygen. With every passing minute of deprivation, more of these essential cells degrade, causing irreversible harm. Physicians frequently rely on a well-known, simple clinical phrase to describe this emergency. Time is muscle. This phrase is much more than a catchphrase. It is a profound clinical truth. It is a vital reality. Each minute of delay translates directly into larger segments of cardiac tissue being permanently destroyed. Damaged muscle that dies during an attack cannot grow back or repair itself. Instead, the body replaces those areas with non-functional scar tissue, which diminishes the organ's ability to contract effectively. This permanent structural loss can permanently compromise a person's physical capacity, placing them at much higher risk for long-term heart failure, arrhythmias, or subsequent cardiovascular issues. Essentially, three main variables control how severe the lasting damage will be. The initial factor centers on how quickly the occluded blood vessel is successfully cleared. Advanced modern options like an urgent angioplasty or special thrombolytic drugs are incredibly helpful, but their efficacy depends on starting them as fast as possible. Any saved seconds or minutes before therapy starts translates into more preserved cardiovascular structure. The next key dynamic is the expansion of the thrombus itself. A vascular clot is not just a solid static plug. It typically keeps expanding right after the first symptoms flare up. As it enlarges, it tightens the seal and exacerbates the lack of oxygen. Thus, taking measures to stall this cascade while help arrives can significantly lessen tissue damage. The final factor concerns the degree of exertion the compromised muscle must perform under this strain. If a person persists in walking, moving up steps, trying to drive, or slipping into panic, the muscle pumps harder, spiking its workload exactly when it lacks the essential oxygen to meet that demand. This severe supply and demand mismatch subjects the vulnerable tissue to excess load, thereby worsening the scope of the injury. Fortunately, none of these critical areas are entirely out of your reach. Responding instantly at the first sign of warning, seeking expert paramedic support, and taking correct protective steps can alter this dynamic to support preservation of cardiovascular muscle and secure a safer recovery path. Realizing how critical every moment becomes allows us to push past natural hesitation, paving the way for swift decisions that preserve vital functions and protect life itself. Being aware of warning. Symptoms represents just a portion of what is needed. An equally essential component is possessing a clear, immediate action plan the minute a problem is suspected. Under stress, confusion and doubt can make people delay, leading to missed opportunities to protect their health. Happily, clinicians highlight three highly structured actions that are recommended because each directly counters a biological challenge occurring inside the system. Executing these sequential maneuvers can yield far better health outcomes and guard against ongoing heart complications. The absolute top priority must always be placing an immediate call to your emergency number. Do not bide your time waiting for symptoms to fade and never rely on them just disappearing without help. Make it very clear to the emergency dispatch worker by saying explicitly, "I think I'm having a heart attack." This phrase lets the medical dispatcher instantly gauge the severity, ensuring the quickest possible response from specialized medical units. Furthermore, taking an ambulance to the emergency department is exponentially safer than attempting to drive yourself or having a loved one drive you there. Paramedics have the resources to begin assessing and treating you as soon as they step into your room. They bring specific monitors, give supplemental oxygen, provide essential medications, and link directly with doctors to prearrange cardiac procedures before you even cross the threshold of the building. This advanced prep work saves vital time in an environment where seconds equal cardiac preservation. Step number 2, provided there are no contraindications and medical staff or dispatch directs you to do so, is chewing one standard strength aspirin. This is usually 325 milligrams total, which is also equal to 4 baby aspirin tablets. It is important to chew rather than swallow the tablet because chewing significantly accelerates how fast the compound reaches your circulation. Once absorbed, aspirin helps make your blood platelets less sticky. Platelets are the specific structures responsible for clot formation. since a blockage inside a cardiac artery can easily continue to recruit more platelets and grow during an attack. Disrupting this cascade is a key goal. Inhibiting this growth pattern can support blood circulation and manage cellular injury while expert clinicians head your way. Keep in mind that taking aspirin is not universally safe. If you have a known aspirin allergy, bleed easily, suffer from a bleeding ulcer, or use heavy blood thinners, you must seek guidance from emergency workers first. Critically, self-administering aspirin must never delay placing the emergency call. It is simply a supportive intervention rather than a replacement for definitive hospital care. The third piece of advice is to cease all current movement and allow your system to rest completely. Find a comfortable spot to sit down, slightly reclined if you can, and make a conscious effort to stay as calm as possible. Loosen tight items around your collar, throat, or waistband to make taking steady breaths easier. Focusing on paced respiration assists in dialing back stress and keeps additional cardiac load to a minimum. Fretting leads to adrenaline releases, driving your pulse rate up and making an oxygen-deprived organ work harder than it should. Resting physically can decrease demand for oxygen and reduce potential harm. Should you find yourself alone, remember to unlock your front entry right after talking to dispatch. Afterwards, sit somewhere near the entry while waiting for responders to walk in. This minor detail ensures there is no delay getting inside your home should your strength fail before assistance reaches you. Do not pace around, try to carry luggage, walk upstairs, or jump behind the wheel. Your single goal is to maintain absolute stillness and let specialized paramedics access you without unnecessary physical blocks. Utilizing these key maneuvers, reaching dispatch first, taking a tablet when guided, and resting calmly greatly influences heart health recovery results. While a lot of people tend to treat a heart attack and sudden cardiac arrest as identical medical phrases, they are distinct clinical problems. Understanding this boundary is very important because the required action for each event is very different. Broadly speaking, an attack represents a circulatory failure triggered by an obstructive clot-stopping blood supply. By contrast, cardiac arrest represents an electrical breakdown where the pulse abruptly ceases, shutting down supply directly to your head and essential tissues. Though a blockage can eventually spark an electrical collapse, they are separate medical concerns, and telling them apart is a critical safety tool. When someone is suffering a blockage, they are typically alert and responding. They will often vocalize pressure in the sternum, feel short of breath, grow nauseated, sweat heavily, or trace pains in their neck, throat, limbs, or torso. Though they are quite sick, they remain conversational and can still engage with safety instructions. In this stage, initiating hospital action is our most essential tool to break the vascular blockade before muscle tissue permanently deteriorates. Dialing local helplines, following their coaching, and resting physically represent your top goals. A full cardiac arrest is a much more sudden and striking event. Rather than staying aware, the casualty falls limp, does not reply, stops regular breathing, or merely exhibits minimal agonal gasps. This occurs directly because blood delivery has dropped below levels that can support essential consciousness. Absent quick intervention, neurologic damage can occur inside of minutes, with chances of recovery shrinking steadily each 60 seconds. Unlike an ischemic episode where patients advocate for themselves, an arrest victim depends completely on observers to save their life. They rely heavily on bystander actions starting instantly. If you encounter a casualty who has collapsed and does not react or breathe naturally, you must notify dispatchers right away or delegate this to a witness while you position yourself. Using speaker mode is a smart move, so dispatch can assist you step by step as you go. The primary task then shifts to executing hands-only CPR. Anchor the lower palm of your primary hand directly onto the breastbone's center. Lock your second hand on top of that position. Keep your arms completely straight and perform deep, swift depressions, aiming for a tempo between 100 and 120 beats a minute. This mechanical pump keeps circulating necessary oxygen to critical neural pathways while rescue vehicles make their way to you. If there happens to be an automated external defibrillator, frequently known as an AED, nearby, send an assistant to get it right away. These devices are intentionally calibrated for bystanders, providing very clear vocal directives at every turn. The equipment checks the cellular pacing itself and only permits a pulse shock if clinically recommended, rendering it straightforward for non-specialists. A prompt start on manual compression combined with defibrillator administration forms your highest protection margin for an arrest victim. Perhaps our greatest take home concept is that taking some simple action beats waiting on the sidelines. Many witnesses wait out of worry they might perform a move incorrectly. Keep in mind that dispatch personnel will remain connected to walk you through each step of the chest compressions. Decisive effort by an everyday citizen serves as a bridge of life until skilled clinicians step in with life support. Distinguishing between these dual events, blockage versus full stoppage, informs the correct survival tactics. This basic clarity can absolutely represent a life-saving factor one day. The single most dependable strategy for cardiac protection is to organize your resources before you ever experience a problem. A crisis naturally provokes high stress, and when fear strikes, reasoning through options on the fly becomes very hard. Under stress, individuals default strictly to prep work they have built beforehand. Because of this, carrying out basic preparation right now represents an asset should an incident rise down the road. Proactive behavior is not a product of fear. Rather, it serves to guarantee you and your household have the exact steps down during vital clinical events. A simple, practical habit involves keeping fresh, regular strength aspirin stored somewhere prominently marked. In suspicious conditions, the phone helper may ask you to swallow or chew this tablet if you meet correct physiological standards. Rummaging blindly around your vanity under immense panic delays your timeline. Storing it in a dedicated spot keeps critical reactions efficient and stress-free. Your whole household should be oriented to where this packet resides. Another minor yet major detail is verifying that your building coordinates can be read easily from external roads, particularly after dark. First responders require legible, illuminated street numbers to plot their final turn. A obscured number on a dark door wastes vital minutes of support that decide how much viable muscle can be saved from cellular demise. Working lights and readable numbers are simple adjustments that directly scale dispatch speeds. For those already dealing with cardiovascular concerns or persistent medical matters, having a detailed history profile outlining your scripts, reactive compounds, and prior issues in an obvious folder is incredibly helpful. Responders can select correct chemical aids far faster if they aren't working blind on your record. Looping in family members allows them to locate and hand this documentation directly over to professionals if your energy fails. We also highly advocate holding candid, honest discussions with the friends or family you reside with. Verify that a spouse, family members, or friends can identify the subtle patterns of cardiac ischemia and understand basic first steps. Make certain everyone realizes that long-lasting pressure, low airway reserve, unexplainable sweats, nauseous periods, or traveling pain down the jaw or shoulders is never just a passing issue. They need to realize that making the professional emergency call is far wiser than testing wait-and-see paths. Let us highlight how important this path becomes through a couple of actual health situations. The first individual tried to disregard the signals, reasoning that the mild fullness would quickly resolve, waiting many critical hours. Although survival was achieved, massive chronic structural damage occurred, significantly decreasing his general energy for the future. A second individual encountered highly similar indicators, but instantly spotted the clinical pattern, mobilized rescue workers without any delays, followed basic rest steps, and completed emergency therapies inside the optimal medical hour. Because of this, almost all cardiac fibers were kept intact, prompting a swift path back to regular, healthy daily functions. This simple contrast holds massive clinical weight. Though genes or general risk values cannot be reprogrammed in a single night, establishing correct preparation stands inside everyone's capabilities. Becoming fluent in physical symptoms, outlining basic safety targets, staging useful supplies, and keeping a firm promise to call for help forms your ultimate recovery framework. These safety structures require minutes of effort, but maintain your capabilities for a whole life to come. Thank you very much for spending your time with us, and consider subscribing to HealthVerse to remain connected to updated medical educational topics.